Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to our presentation on handling emergencies related to adrenal insufficiency in dental settings. We will share important information and practical tips to help you manage these situations effectively. By learning these key protocols, we can keep our patients safe and achieve the best results during dental procedures. Thank you for joining us today. Adrenal insufficiency occurs when the adrenal gland do not produce sufficient steroid hormones. This can be due to primary issues like Addison's disease or secondary causes such as prolonged corticosteroid use. Proper management is crucial to prevent serious health complications. Primary adrenal insufficiency, also known as Addison's disease, is a rare condition where the adrenal cortex is destroyed. Secondary adrenal insufficiency is more common and occurs due to the administration of corticosteroids for other medical conditions. Patients with secondary adrenal insufficiency often do not know they need extra medication during stressful situations. They may not inform their dentist. That can lead to complications if they are not properly managed during dental treatments. Patients with adrenal insufficiency might require additional medication during times of stress. Patients who are at risk for adrenal insufficiency are those who have taken 20 milligram or more of cortisol daily for at least 2 weeks anytime during the year before a major oral surgical procedure. This table taken from your textbook showing commonly used glucocorticoids with their equivalency. The stress response can be impaired in these patients due to the lack of endogenous glucocorticoids. For minor dental procedures under local anesthesia, additional corticosteroids are usually not necessary. To address significant adrenal suppression, please refer to the protocols for managing adrenal insufficiency. You can watch our previous video from the medical problems chapter for more detailed information. Early signs of adrenal insufficiency include mental confusion, which may affect decision making and concentration. Nausea can occur, making the patient feel sick and potentially leading to vomiting. Fatigue is a common symptom, causes the patient to feel excessively tired. Muscle weakness might be noticeable, affecting the patient's ability to perform physical activities. As adrenal insufficiency worsens, mental confusion can become severe, leading to disorientation. Patients may experience significant pain in their back, abdomen, and legs. Vomiting can occur frequently, worsening dehydration and weakness. Hypotension or low blood pressure becomes a serious concern, requiring immediate attention. Without treatment, the patient might go in and out of consciousness, with coma indicating a pre-terminal stage. This box from your textbook showing manifestation of acute adrenal insufficiency. In the event of an additional crisis, all dental treatment should be stopped. Check the patient's vital signs to assess their condition. If the patient is hypotensive, place them in a head down, legs elevated position to improve blood flow to vital organs. Call for medical assistance to ensure the patient receives the necessary care immediately. Administer oxygen to the patient to ensure adequate oxygenation. Establish venous access to administer medications and fluids. Hydrocortisone sodium succinate is commonly used in emergencies for its quick effect. Dexamethasone is another option known for its long-acting properties. Methylprednisolone can also be used, especially if other medications are not available. Administer 100 milligram of hydrocortisone sodium succinate IV or intramuscularly. Rapidly administer IV fluids to correct hypotension and stabilize the patient. IV fluids should be administered quickly to address hypotension and support circulation. Continuously monitor the patient's vital signs, including blood pressure, heart rate, and oxygen saturation to ensure stability. Assess whether the patients require basic life support measures such as CPR. If the patient loses consciousness or stops breathing, Initiate BLS immediately to maintain circulation and breathing. This box shows management of acute adrenal insufficiency. To conclude, always be prepared to handle medical emergencies during dental procedures. It is important to recognize the risk factors for adrenal insufficiency and manage crisis effectively. Timely identification and appropriate management of adrenal insufficiency are critical to prevent life-threatening complications. Educate patients about their conditions and the importance of medication adherence to manage their health effectively. Thank you. Wish you best of luck.